Hi, I'm Dr. Ashley Simpson. I'm a breast surgeon at St. John Medical Center in the Maltby Breast Health Center. So I am oftentimes the first point of contact for patients who are diagnosed with breast cancer. And in that role, I assume the role of quarterback, where I basically am not only responsible for initially talking through a patient's diagnosis, but also determining what other treatments they may need, what specialists they need to see, if there's anything in particular about their diagnosis or their condition that warrants other considerations, like fertility counseling or, however I can best help them. Clinical research is so important because it drives how we treat patients. Over the years, the management of breast cancer has radically evolved, all because of research. Things that I do now in surgery are markedly different than even what I learned in fellowship just several years ago because of research. With the research, we're able to, in some cases, de-escalate surgical treatments to minimize some of the side effects that patients encounter related to our surgeries. We are not only responsible for removing the tumors from the breast, but also staging the axilla, meaning checking the lymph nodes in the underarm to assess if there's been spread of the breast cancer cells up to the lymph nodes. Historically speaking, anytime somebody had a breast cancer diagnosis, this mandated that all of the lymph nodes in that region were automatically removed. But one of the side effects of doing so is the risk of chronic arm swelling we call lymphedema, which is a lifelong condition, and it's a very morbid condition for patients to deal with. Because of research that had been carried on decades before, we developed the procedure called sentinel lymph node biopsy, which samples the axilla, removing only 1 or 2 lymph nodes. And in doing so, that's dramatically decreased the risk of lymphedema for these patients. Most recently, just a few years ago, we were able to use the information from that previous trial to translate that into treating our mastectomy patients as well. So the treatment paradigm has completely shifted in the management of the axilla to being more conservative and decreasing that risk of complication. I think we're in our infancy in learning how nutrition can impact cancers, including breast cancers. There actually has been some research, particularly for breast cancer survivors, that avoiding sugary beverages can decrease the recurrence rate of breast cancer, which is huge. I think if you look more into the data that's out there, I think added sugars and processed foods may not cause the breast cancer itself, but I think is an implicating factor, probably one of many. And if we're able to be mindful of our sugar intake and be mindful of the sources and where we get our food, I think that putting cleaner products, organic when possible, into your body overall is going to optimize your health. It would have to start in the lab, first of all, right? Because I think we're dealing with issues that are really at the cellular level. And so it would be interesting, I think, to see how breast cancer cells or inflammatory markers react when there's differences in nutrition. And if somehow we're able to quantify that changing our diet can affect those inflammatory mediators and those markers, we may have concrete data and evidence to show how nutrition can play a role in either the development or the prevention of cancers. What I would say to somebody if they came into my office asking about clinical research, one of the questions might be, why should I do this? Well, number one, clinical research enables a patient to embark on groundbreaking opportunities that aren't quite open to the public yet. But more importantly, their results and their participation in research could have very wide-reaching effects on how we treat the future generations of breast cancer patients. And thus far, every innovation that we've made has improved outcomes and decreased harm. So I think it's well worth it. Diversity is important because breast cancer does not discriminate. It affects all people of all walks of life from all different populations. And so it's really important that our research is diverse so that we're able to extrapolate and draw those conclusions from the study and make sure that that applies to all of the patients that we treat, not just one particular demographic. We used to say, breast cancer happens in women that are postmenopausal or women that are older, but we're just not seeing that now. We can see women as early as their 20s being diagnosed with breast cancer. So it's just extremely important that all women are being evaluated. Most of the time when breast cancer is diagnosed, it can be without a family history. So no one is really removed from the risk of developing breast cancer. And that's part of the reason why research is so important, because it can affect every single woman. And if we're able to do research that can show us how we can minimize the risk of breast cancer or improve outcomes, it's well worth it.